Hello everyone, today's topic is circle of willis. This is a structure of circle of willis in the brain. And this is a structure we going to see damages of posterior inferior cerebral artery and anterior spinal artery, and what are the syndromes we're going to cause for everything. Okay, and this is the first cause in the pica, like posterior inferior cerebral artery we say has a pica. In pica is damaged, lateral medullary Wallenberg syndrome will cause. In this, cranial nerve 9, 10, 11 will be damaged and decrease pain and temperature. In contralateral means it's opposite side. Okay, opposite body. Ipsilateral means same side, same face, like the damage. And ipsilateral Horner syndrome and ipsilateral ataxia, dysphagia, hoarseness, and decrease CAG reflex, hiccups, vitiligo, and nystagmus. If any damage to the anterior inferior cerebral artery, this syndrome is called lateral pontell syndrome. So supplied by labyrinthine artery is paralysis of the face and decrease. The face is paralyzed, the salivation and lacrimation will be decreased, and the taste sensation anterior 2/3 of the tongue will be decreased, and in contralateral body structure pain and temperature will be decreased, and ipsilateral face also. And Horner syndrome ipsilaterally damaged, and ataxia and dysmetria ipsilateral sensorineural deafness and vitiligo. Next, we're going to see anterior spinal artery. If damage to here in this location, syndrome is called median medullary syndrome. Okay, in this damage, hypoglossal nerve will be damaged, and contralateral upper and lower limb will be damaged. Decrease contralateral preoption and ipsilateral hypoglossal dysfunction. If hypoglossal dysfunction is damaged, is tongue deviated to the ipsilateral. This is very important. Tongue deviated to ipsilateral, other same side. Okay, and next going to see posterior cerebral artery is damaged this location. Okay, in this area is damaged, occipital lesion, like occipital region will be damaged. So contralateral hemianoplia with macular sparing in optic location. Okay, optic nerve. So alaxia, optic region. Okay, alaxia without agraphia and prosopagnosia. Next, going to see basilar artery damage in this location. We going to see pons in this area. The pons, medulla, and lower midbrain is supplied. Syndrome is called locked-in syndrome, and RAS pad conscious is preserved. Loss of voluntary facial except blinking reaction, mouth, tongue movements, and horizontal of loss. Next, going to see in this location anterior cerebral artery. This one is anterior spinal artery. This is cerebral artery. Okay, in damage is contralateral paralysis and sensory loss in the lower limb and urinary inconsistency. Okay, next going to middle cerebral artery. Here in this location is this region is temporal lobe and frontal lobe. Temporal lobe means Wernicke area and frontal lobe is Broca area. It's a contralateral paralysis and sensory loss in the lower face, upper limb, and apaxia. And Wernicke apaxia is associated with right superior quadrant visual field due to defect in the temporal lobe. Next, going to see lenticulosteroid. This location is here. In this location, okay, is any damage, steroid and internal caspals, contralateral paralysis and absence of cortical sign, example neglected apaxia and visual field loss. Okay, thank you so much.